Good morning, everyone, and a very well welcome to all of you. I'm Tamara, the IMNIS coordinator here at the Australian Academy of Technological Sciences and Engineering, but we also like to call it ATSE. Before we begin, I'd like to begin by acknowledging the traditional owners of the lands from where I'm joining you from today, the Ngunnawal people. I also pay my respect to the elders past and present. I'd also like to extend that respect to any Aboriginal and Torres Strait Islander people joining us today, as we acknowledge the traditional owners of whatever country you're joining us from today. As we come together to share and discuss our knowledge and experience, we also recognise the traditional knowledge and the deep history of innovation of Australia's First Peoples. Before we get into today's webinar, I just want to cover a little bit of housekeeping. Firstly, I'd like to remind everyone that by registering and attending today, you have agreed to abide by ATSE's Code of Conduct, and this includes when you put questions in the Q&A channel. This webinar will be recorded and the recording will be made available on ATSE's YouTube channel later. We are also happy to share that link with all our registrants today. Captions are enabled today, so if you require them, they should pop up at the bottom of your screen. As the session progresses, a feedback survey will be shared later and would love it if you could complete that for us. We're keen for this to be an interactive session, so please feel free to submit your questions in the Q&A box at the bottom of your screen at any point during the webinar. Before I hand over to today's moderator and brilliant panelists, I thought I'd share a little bit about myself and my STEM career journey. So as mentioned, I'm the IMNIS coordinator here at ATSE, and I'm really passionate about science communication and supporting the next generation of STEM leaders and STEM professionals. I went to university and I studied chemistry, and this is also where I fell in love with science communication. I saw the importance of not only studying research and investigating different scientific topics, but also the importance of science and scientists connecting with community. This led me to pursue a career in community development and science communication, where I now work at ATSE in our IMNIS program, which supports PhD students and early career researchers to connect with industry mentors and grow professionally. Another one of our wonderful ATSE programs is Stella, who has brought this webinar to us today. Stella is designed to engage young people in rich STEM learning at school using hand-on curriculum aligned resources to explore principles in sustainability and renewable energy. We have over 280 lessons and over 100 hands-on activities for the use in classroom. You can find out all about Stella by heading to the website at stella.org.au. Along with Stella, ATSE creates pathways to inspire young people to pursue careers in STEM through a few programs, one of them being Elevate Boosting Diversity in STEM, which is a scholarship program that will award up to 500 undergraduate students and postgraduate students scholarships, as well as IMNIS, which is where I work, where we have PhD students and early career researchers engaging with professional development and mentoring to grow professionally. You can find out all about those programs by heading to our ATSE website. So the theme for this session is From Classroom to Clinic, Careers in STEM for a Healthier Future. This is an exciting chance for us to explore the many pathways and career opportunities available for students in the health technology sector. And we have some incredible panelists joining us today to do just this. With that, it's my now absolute pleasure to introduce our first speaker and ATSE Fellow Adjunct Professor Craig Rayner. So Adjunct Professor Craig Rayner is a clinical pharmacologist and leading authority in model-informed drug development. He has made key contributions to numerous medicine approvals, including treatments for bacterial infections, influenza, and river blindness, and has designed hundreds of clinical trials. During the COVID-19 pandemic, he provided expert scientific advice to governments, the World Health Organization, and NGOs, and led to work and debunk and uncover potential COVID-19 interventions. He currently serves as Director of Translational Medicine, Infectious Diseases and Global Clinical Development role, uniquely based in Australia at the RRC. He has the ability to bridge seamlessly between the private sector and academia, and it's our pleasure that he is here with us today. Over to you, Craig.
Thanks very much, Tamara. Look, welcome to all the students, educators, and other members of the community joining us today. I want to also acknowledge that I'm joining you from the Wurundjeri country of the people of the Kulin Nation, and would like to recognise elders past, present, and emerging, and also acknowledge that we're meeting on land which has never been ceded. So, look, it's great to be here talking about careers in health technology and highlight the importance of this field in a rapidly shaping world. From cutting-edge medical research and biotechnology to health data analysis and public health initiatives, the health technology world offers really diverse pathways for growth and impact. Now, whether you're interested in science or technology, engineering or mathematics, there is certainly a career for you in the health tech space, and there are so many different paths that you can take to get there. I'm super excited to be here with our other panelists, Dr. Catherine Morgan and Jemima Kang, to showcase just some of the vast array of opportunities that are available for students passionate about making a difference and how we got to where we are today. So I'll soon introduce both Catherine and Jemima to hear about their own careers, but first, I'd like to tell you a little bit about my own work and journey that I took to get to where I am today. So here we go. That's me with the little arrow over my head there. So I am the first of all of my extended family ever to get actually out of high school. So it was quite unique. And I studied in Canberra. And if we move to the next slide. And ultimately through my journey, I entered into pharmacy as my first degree. And at the end of pharmacy, I had some student hours here, which is in the Luma community in northwestern Australia in the Kimberley region. And I was spent some time up working with the Royal Flying Doctor Service and working in regional health. And it was here really that my North Star was identified, what my purpose and what my vocation was. And it really lit a fire for me that sort of transcended my entire career. And that was around how do we get more equitable medicines to serve those who are less fortunate than perhaps you and I. Next slide. And what it kind of taught me was that there are many different ways to kind of address a very massive goal that could be around health inequity and trying to develop medicines in those difficult and intractable spaces. And so most folks generally start off a career thinking in different swim lanes. They want to be doing clinical practice, perhaps they want to be in academia or global health. Some want to go into industry or entrepreneurship or work in the government to do it, or in the ecosystem, and so on. What I wanted to do is really, I was just so curious about all of these areas. I'm sort of that person on the blocks at the side of the pool who wanted to swim across all of the swim lanes, because many of the largest intractable problems, I think, can actually not be defeated by focusing only on a single swim lane. So next slide. So what that really did, it kind of explains why my career has been what it has been. So on the left, you'll see that I've done a number of degrees and doctorates and MBAs and so on over the time. And you'll see a little line that's going there, which shows you that I've lived in Australia and the US and the UK and Switzerland and back to the US a couple of times. And my primary work roles have moved from clinical practice into academia, into the pharmaceutical industry, into entrepreneurship and starting companies, and ultimately to where I am now, and that is in working in translational medicine in the infectious diseases and global health space at Moderna here in Australia. And I think probably the key thing which has underpinned my journey has been my passion, which was ignited from that time in the Kimberley region around translational medicine, clinical pharmacology, and infectious diseases. That's been a common theme throughout. And importantly, doing really impactful stuff with cool people. And if we move to the next slide. And this curiosity about moving across the swim lanes and doing impactful things has really given me a wonderful opportunity through my career to create impact in lots of different spaces. Patients, I've had the fortune of working with great people to bring new medicines to patients, like moxidectin to treat river blindness, Tamiflu to treat little babies infected with influenza, antibiotics. On the top right here, from an innovative perspective in academia, I've published many publications, more than 120 in top journals and clinical trials. It's afforded me the opportunity to work at ecosystem and policy level, whether that's with the World Health Organization or the UN or other areas of government, or even working with regulators. And at the same time, it's given me the opportunity to found and develop important commercial organizations, including IPOs of more than $1 billion in the US. And so I hope what you can see here is that by swimming across the swim lanes, by being curious about how you can derive the most impact for a vocation, you can create a lot of impact in your career. Next slide. And the other thing I just wanted to also mention, most people really just focus on the career side. And from my perspective, this is about being a very whole person. And if you're able to excel and have fun, not only in your work, but have fun at home and fun with your loved ones and fun with your interests, you can really have a very rich career and also rich life. So with that, I think I would like to stop here, and I'm very excited to now introduce our next speaker, which is Dr. Catherine Morgan. And Catherine completed her Bachelor of Science in 2016 and a Master of Science in 2018, both majoring in chemistry. She then completed a Doctor of Philosophy in Chemistry at the University of Melbourne in 2023 and has continued her research at the really important Bio21 Molecular Science and Biotechnology Institute in Melbourne. Now, her research focuses on designing new personalised molecular treatments for cancer using metallic radionuclides and the development of diagnostic imaging agents for Alzheimer's disease. Her research uses a combination of synthetic chemistry, radiochemistry, biochemistry, and cell biology. Teaching undergraduate chemistry laboratory classes is really one of the highlights of her time as a postgraduate student, and she loves working in the laboratory. So, Catherine, thank you for joining us.
Thank you so much, Craig, for that introduction, and thanks for inviting me to be part of this panel discussion. So, as Craig mentioned, I am a chemist, so I'm actually an inorganic chemist. And what that really means is what I'm really most interested in is studying metals and designing what you could kind of best describe as these molecular cages. And so I make these cages in the lab, and these cages are designed to effectively trap metals within them and make these really stable molecules. We call them complexes. So just looking at my little career trajectory and my kind of career journey so far, I haven't really had the most straightforward science journey. And so I finished high school in 2012, which was, over 10 years ago. And when I finished high school, I really wasn't sure what I wanted to do. I knew I wanted to study something, but I didn't really know what I wanted to study. And so I actually chose to study an arts degree because I really loved Italian and I loved history. And I thought, that's what I'm going to do. So I began my arts degree, and after a year, I'd really realized that I didn't want to study arts anymore. What I was interested in was studying science. And so I actually transferred into a science degree. So knowing now that I wasn't interested in arts, I was interested in science, I quickly began falling in love with chemistry, which sounds a bit nerdy, but I really enjoyed studying chemistry. So I decided to major in chemistry, and it wasn't really until my last year of my bachelor degree that the university offered this research project. So it was a whole semester, so 12 weeks. And I got to be, instead of, the practical classes that go for an hour and you write up a report, I was actually placed into a real life chemistry lab. And you can kind of see this quite dirty, scary looking chemistry lab. And so I fell in love with it. I loved it. I thought it was a really transformative experience. It was also terrifying. I was completely thrown into the deep end. I didn't know exactly what I was doing, but it was a really transformative experience. And I really enjoyed it. And so I decided to do a master's, as Craig mentioned. And that's when I really honed in on my chemistry skills, so my fundamental chemistry skills, so that by the time I got to my PhD, I was able to draw on all of the experiences from, my undergraduate degree, my master's degree, and my chemistry background, and focus that chemistry knowledge on developing these radioactive metal complexes, these radioactive cages to treat cancer. And so my research really focuses on treating or developing new treatments for cancers that traditionally are the hardest to treat. So we have, incredible clinical, drugs and treatments out there already for many cancers, but those ones that are the hardest to treat, that's what I'm interested in developing new treatments for using radiation therapy. And so you can see down in the bottom here, there I am looking at my cancer cells. So I make these compounds in the lab, I test them, and I analyze them. And that really brings me to what I'm studying these days, which is the effects of the radiation therapy on a cellular level. And so this is a picture of some cancer cells, and all of those little green dots, they show irreversible damage to DNA, so damage to tumor DNA, which is really what I'm doing now. So yeah, that's kind of my career trajectory over the last 12 years.
Oh, Catherine, thank you. That's incredible to hear about your particular journey in health tech, your passion for making a difference. Now, for everyone online, please don't forget, if you've got questions for Catherine, to enter them into the Q&A option at the bottom of your screen now, and we'll get to those questions in just a little while. But for now, I'd like to welcome our third and final speaker for today, Jemima Kang. So Jemima is a PhD candidate in the School of Computing and Information Systems at the University of Melbourne, where she's focusing on using natural language processing techniques to analyse mental health discourse on social media. Now, prior to her PhD, Jemima completed a Bachelor of Psychological Science with honours at the University of Queensland, where she completed her honours project on sexual orientation discrimination in the gig economy. Jemima is a 2024 FTSE Elevate Boosting Diversity in STEM scholar, and we're really excited to have Jemima here today. Over to you, Jemima.
Hi, everyone. So yeah, my name's Jemima, and I'm currently doing a PhD where I use natural language processing techniques, which essentially means the analysis of text data to look at mental health discourse on social media. And also I'm interested in how this has changed over time. And so like Catherine, I didn't have the most linear STEM journey. So I graduated from a Bachelor of Psychological Science. But when I started university, I actually was doing biology because I was good at it in high school. And even though psychology was what I felt most interested in, I thought at the time the only pathway was to become an actual psychologist or a therapist, which is not true at all. So I realized quite early on in my degree, after changing into psychology, that I had an interest in research. And so I started volunteering in my second year to try and get an insight into what this was actually like. And so I volunteered at this center called the Early Childhood Developmental Center at UQ. And I did this for a little while, and I was luckily able to attend a conference overseas based on this work that I did. You can see in the second picture from the left, that's my first conference. And eventually I was lucky enough to get a part-time job doing research assistant work, which I did alongside my degree while I was studying. And during this, I learned a lot of valuable skills, and I published some papers. And then in 2018, I was awarded the New Colombo Plan Scholarship. You can see me holding the certificate in the picture of the newspaper there. And this supported me to study overseas and do language training and an internship in the Indo-Pacific region. And so at this point, I was curious about what else I could do with my psychology degree. And so while I was in Malaysia, I'd interned at a non-for-profit women's rights organization where I was doing research still, but for their political participation programs. And so I was still using a lot of the skills that I had learned and picked up during my time as a research assistant, but with a different kind of application. And so I ended up being overseas for about a year and a half. And then in 2021, I graduated. And because of my interest in research, I was considering going straight into my PhD. But I also felt like I wanted to try out other things before going into it to make sure that it was what I really wanted to do. And so I wanted to try out a more industry focused role. And so I found a job at a startup. And in this, I was doing more people and culture, human resources kind of work, and it was a great experience. And I also still found a lot of use for my research skills because I was doing a lot of company surveys and whatnot. But I realized that wasn't for me. And then I felt ready to go back to university and start my PhD. And so now I'm about 9 months into my PhD, and you can see me standing at my desk, really excited when I first started. And in my PhD, like I said, I use natural language processing techniques to analyze mental health discourse on social media. And so essentially, I'm using machine learning algorithms to understand and analyze and interpret language data. And so nowadays, everyone who has access to a phone or a computer pretty much uses social media, and people are increasingly turning to social media to talk about and understand their mental health. And so we have this wealth of rich data that we can use ethically to analyze and improve our understanding of how mental health manifests in language and discussions, because ultimately we're still learning a lot about the brain and what it actually means to have certain mental health conditions. And so that's what my field of work is doing. And so, yeah, I guess I, again, didn't have the most linear journey into what I'm doing now, but even though a lot of the things I tried out didn't end up being what I'm doing now, I still learned a lot and was able to use the kinds of skills that I'd learned in my research assistant work. And it all helped me kind of realize that this is what I really wanted to be doing.
Oh, thanks, Jemima. That was brilliant. It's really, really exciting to hear about your nonlinear path. And I'm very much looking forward to seeing the results that come out of your very, very interesting PhD program as well. So look, we're going to move into the Q&A section now. So I'd love to bring both Catherine and Jemima back so we can start to answer some questions from the audience. We've got a couple of questions which are already starting to pop up. So I'd encourage folks to please post any questions that you do have in the Q&A box so we can answer them. And if we can't get to the questions, that's okay. They'll still be answered and we'll send them to you. So just keep those questions coming. But before we look at those, I think I actually have a question I'd love to ask each of you. So Catherine, if I can start with you, to help the audience just better understand your career, could you tell us what a day in the lab or a day at work actually looks like for you?
Yeah, absolutely. And so I showed a couple of photos of me kind of in the lab, my fume hood. And I think it's kind of interesting because it's definitely different to how it's kind of portrayed in the media or, you know, how you kind of think about it from TV. And so I have this kind of messy little fume hood that protects me, keeps me safe. Safety is obviously a massive part of the research that I do. And I work on these kind of different projects. And so I'll spend up to a year, maybe more, maybe less on a project. So at the moment, what I'm spending most of my time on is a prostate cancer project, which is a really exciting project. And so every day I do something different, but at the same time, I'm always kind of growing and learning and kind of building on my kind of research. But a lot of the time I'm working at different hospitals. I work at Peter MacCallum Cancer Centre in Victoria. I work up in Queensland. And so every day is different, but every day I am kind of mixing things together in a lab, purifying things, a lot of analysis, a lot of notes, a lot of, keeping on top of everything that I'm doing so that I can reproduce it. Yeah.
Brilliant. No, thank you. So Jemima, I alluded a little bit to my North Star. Why do you do what you do? What's your driving purpose?
Yeah, that's a really good question. So I've always been interested in people. Like, I like reading things that have to do with people, and I like watching documentaries that have to do with people. And I get excited by the idea of working with others. And so psychology felt like the right choice for me in terms of my degree. And then while I was studying psychology, I always felt like I was good at the statistics courses. They felt like quite enjoyable for me to study, and I felt the style of working and thinking made sense to me. And so I felt like doing the coding exercises were also like quite rewarding. And then I also realized while doing different work experiences, what felt important to me in the work that I was doing work that felt relevant to like today's society, or had something to do, or like was tied to my identity in some way. And so I guess reflecting on all these things, I feel like helped me figure out what I wanted to be doing, and also doing the PhD topic that I'm doing, because I'm broadly looking at mental health, which is very people related, and it's an important issue in today's society. And then the natural language processing aspect of it really draws, I think, on my like natural gravitation towards statistics and coding. And I guess these are also the reasons for they're also my driving purpose in what I do as well. So yeah.
Oh, that's brilliant. And I think, having a vocation, if you have a vocation, you actually never have to have a job or a career, right? So,
Definitely.
yeah, so thank you. So let's pivot. So I've got a few questions here. I might skip to, first of all, a very pragmatic one. I've got Year 9 class here. What subjects should students be selecting moving into Year 11 for a career in health tech? Does the level of maths matter? Jemima or Catherine, do you want to take a first stab at that?
So I think health tech, you do obviously think STEM. And I think I'm not exactly sure about which specific maths, because it does change with like different universities and different things. But I think on the whole, subjects like maths and, physics or chemistry or even, biology, psychology, they kind of teach you to think in a specific way. The content maybe is not as important as you learning to be a problem solver. Because I think a career in STEM pretty much boils down to solving problems. Things never go the way you anticipate them. And if you have those kind of STEM-based subjects, you do learn how to methodically solve a problem, or if something changes, you can still solve it. And so I think, that's probably, the summary I've got.
Great. Jemima, anything to add?
I guess from my experience, what you end up doing in high school, if it doesn't align with the degree that you want to be doing, it's quite easy also to pick up a couple of subjects that give you that level to get into the course that you want to be doing. So in the end, it doesn't matter if you've taken courses in high school that might not is like exactly lead to the degree that you want to be doing. It's really easy to kind of pick up other subjects and then meet the requirements and change into it eventually. So I feel like what you study in high school doesn't exactly determine what degrees you can go down and what paths you can go down in health tech.
Yeah, and I might answer it I have a 14-year-old, so he's in Year 8, so not in Year 9, and it's one of the things that he's sort of pondering as well, and I think the key thing is to Find things that you are energized by. I think you do have to keep in mind that if you are going into the health tech field, you know, biology, chemistry, maths, all those things are important because you'll end up applying parts of those. And as Catherine nicely said, you know, it is about the problem solving. So I think those areas are very natural and often are prerequisites to get into many courses. So, you know, sort of begin with the end in mind, at least for me, trying to get into university and scan those. But I think you really want to be doing those things that ignite your passion and your enthusiasm, because as you said, you know, Jemima, you can always pick up certain subjects at a later stage as well. Okay, so I've got a question here that says, what is the coolest part about your job? So Jemima, maybe I'll start with you this time and then go to Catherine.
Yeah. So for me, one thing that I find really cool about the area that I work in is how fast moving natural language processing is. People are still figuring out new ways of analyzing data and developing new algorithms. And so every time you go to a conference, it's a new algorithm that's being spoken about. And so it's really fun, I think, to be in such a fast moving field. And I think for me, one of the parts of work that I enjoy is being able to learn new things all the time. And so being in NLP means I'm constantly learning new things. So I would say that's one of the coolest parts of what I do. And then I guess just like being a PhD in general is a really interesting time of people's lives. People always enjoy their PhDs when they look back on it, I think, because I think you essentially get to code work every day and you're just learning and looking into a topic that you find really interesting. And so every day is really cool for me.
Very good. Catherine?
Yeah, I think something similar to me is kind of going where no one has gone before, or doing things that sometimes it can be incredibly frustrating because you just want to know the answer, or, you know, things aren't working. And again, it might come across as obvious. I do a lot of problem solving in my job. But you know, on reflection, or, you know, when something does work, it's so rewarding. I get a lot of yeah, I really find the work rewarding, and I think that kind of makes it cool in a nerdy way.
Look, I think I'm getting really excited by both of those answers. If I sort of reflect, you know, in this kind of space, it's all about lifelong learning, and all we do is try to solve very difficult problems. And so every single day you're learning new things. And so if that's the kind of thing that gives you energy, then, you know, this space is amazing. I find that particularly cool. I would say working with cross-functional teams. What does that mean? Well, when you're developing medicines, it is an absolute team sport. There's not like one smart person who develops a medicine. So there'll be people who've spent, you know, decades in a particular area that might be, let's say, in biology, others who might have a decade of experience in pharmacology, others in chemistry or various other areas. And that's how you make a team to develop medicines. And when you ultimately, you know, bring a medicine to patients, or you get some really interesting findings in some research or a clinical trial, it's super awesome. It's a great feeling to know that it was the team that helped you do that. So I think that for me is the coolest part, is working with these really, really bright people, learning from them, and everything that you're trying to do is to, you know, is to uncover new ways of tackling intractable problems. So another question, a bit of a practical one. This one's for you, Catherine. Did it impact you much changing degrees during university? Did it take like a lot longer to finish? Does it put you behind your peers? What's your thoughts there?
So doing the arts degree for a year obviously added a year on. But at the same time, like, I really don't regret it, because I think Jemima also mentioned earlier, sometimes you don't know what you do like until you kind of know what you don't like as well. And so I potentially might have always thought, oh, what if I'd done this? Whereas I now know definitely I love history. I love reading books. I love the language of Italian, but it's more of a hobby. It's something fun that I do on the side. Whereas I now know that that's kind of, that STEM was my pathway. So it does take a little bit of time. In terms of being behind your peers, maybe in the first couple of years I was considered behind my peers, but like as we've all gotten a bit older, I know so many people that have done their undergrad degree, they've worked for a couple of years, and then they've said, this isn't for me, and they've retrained, or they've done a master's, or they've done a completely different career shift. And so I think, you know, maybe after 1 year you're behind, but after 10 years, everybody is doing their own thing. So it really doesn't impact you in the long run, no.
I think we were talking about this before, and that is, I don't think any of us know what we want to be when we grow up. And I think it's actually just getting comfortable with that, is that you don't have to feel that that you're actually behind. It's your own journey. You shouldn't be comparing yourself to others. It's your journey. You should only be really just focused on that. So, Jemima, here's one for you. Do you think the ban on social media the government is talking about for young people is a good thing or a bad thing?
I mean, I feel like I'm not the person to make a strong call on this, but I do generally think that it's a good thing, because social media has pros and cons. But particularly for young people, they can be quite vulnerable in some ways because they're still growing up and they're still learning about things and learning about themselves. And so I think ultimately having some protection in ways against this can be really helpful. But on the other hand, social media can also be really good for people. Like, it helps them find communities and helps them kind of learn about their identity. And so there's pros and cons. And I guess in the end, my answer is it would depend on how the government would implement such a policy. Yeah.
Right. Well, thank you. So I'm just conscious of time, and I think we've got two last questions. So there's one to me. How do you get a placement in pharmacy in a remote place like that? What challenges did you face moving from home like this? Great question. I think the way I was able to achieve that was, believe it or not, I ended up ringing up every hospital pharmacy that was around. And it's something that individually I just, it just was calling, and eventually was able to make that happen. So I think in terms of what was it like moving from home? Well, I think everyone takes a gap year and they travel and so on. And for me, that was, it was just exciting. I was going to a really cool place in northwestern Australia, and I was going to be learning some interesting things. From my side, I was kind of like a kid in a candy store. It was a very exciting thing. So the final question: how do you get exposed to ideas and people which help you find topics that are enjoyable to work within STEM? So, Catherine, can I ask you to have a crack at that one as a start, and then Jemima?
Yeah, absolutely. I think definitely online, there's so much potential there's so much exposure. You can really go down the rabbit hole of all the different careers and things. In terms of like face-to-face, something that I really enjoyed was just going to an open day, like at a university, and actually talking to, they always have students, like early career researchers, as well as, the professors and the lab heads. And if you go to one of those kind of careers days, open days, you can say like, what do you actually do? Like, what's your research? And because I think in terms of like chemist, it's a very broad term. We have a really, really broad range of people and their specialties. But yeah, even just asking people is often really helpful.
Terrific. Jemima, what do you think?
Yeah, I mean, I agree with everything Catherine just said. Online, going to open days. I also think for me, what really helped while I was doing my undergrad and afterwards was just really trying to get as many experiences as I could outside of the classroom. And so that meant like internships or volunteering at the time, as a research assistant. And I think because at that point you sometimes don't even know what exists out there. And so I guess I just tried to try everything that I could. And I felt, even though a lot of those things I didn't end up doing, they all helped me kind of figure out the kinds of topics that I was actually interested in. Because I would ask myself questions throughout all of it, like, what am I naturally gravitating towards? Or what am I actually finding interesting about what I'm doing, even though the role itself may not be suited for me? And so like asking those kind of questions helped me realize what I was like generally or like genuinely interested in, versus like things that I was maybe just doing and just trying out. So I think, yeah, extending yourself beyond the classroom in university really helped me personally.
Oh, that's brilliant. And look, being on the receiving end, I would say, you know, this is sometimes much easier for extroverts than it is for introverts, and just recognizing that. But it is really important to try to network. And, you know, even if you can force yourself and maybe find friends to go along to some of these things if you're more introverted. And the questions that you want to ask is really just about, can you provide some advice? And when you do that, you start to expand your networks. And if you say, look, is there anyone else I should talk to? Each time that you're having that networking opportunity, if you can say, all right, that was wonderful, can you give me some advice? Is there anyone else I should talk to? It starts to become a bit of a flywheel. It means it keeps building on itself. And often we say in this environment, it's, you know, if you ask for a job, you'll get advice. But if you ask for advice, you never know, you might get a job. So do think about that. So look, unfortunately, that's all we have time for. I'd like to once again thank Catherine and Jemima for their time today, and also thank all of you in our live audience for joining in. Some great questions there. We hope that you took something away from today's session, and would love to see you in career in health tech someday. So back to you, Tamara, to close us out.
Thank you, Craig, so much for your time. And thank you, Catherine and Jemima, for your amazing contributions. I loved the discussion about the non-linear pathways and finding what you like and what you don't like in STEM and using that as a way to find your career. I would also like to extend that thank you to all the classrooms and officers who have joined us today. We hope that you've found something valuable to take away from this session, and that you have a better idea of how many different careers you can pursue in health tech to help build a better future. This is the last Shape Your Future for 2024, but please look out for more amazing sessions that will keep running in 2025. At the end of the webinar, you'll be asked to complete a short survey on your experience today, and we'd really appreciate your feedback so we can keep bringing you incredible sessions like today. Thank you once again for joining us, and see you all next time.